Welcome back to the Health Decode channel, everyone. Today, we're diving into a very sensitive yet critically important topic for the health of each and every one of us. The hidden secrets within the final product after each bowel movement, your stool. You might usually rush to dismiss it without much thought, but the truth is, your stool is the most honest mirror reflecting the state of your internal health. From the early signs of minor digestive upsets to warnings about serious medical conditions, everything is intricately encoded in the shape, color, texture, and even the smell of the golden nuggets you excrete daily. Do you want to decode these messages? Do you dare to face the shocking truth about what your stool is trying to tell you? Let's join Health Decode as we unveil this secret and explore a health aspect you've never considered before. Part 1. The miraculous and complex journey of digestion and stool formation. To fully understand the significance of stool, we need to begin by exploring the complex journey of food through the body and the process that forms this final product. The first stage, mouth and esophagus. Digestion begins as soon as food enters the mouth. Here, food is ground down by the teeth and mixed with saliva containing the enzyme amylase, which starts to break down carbohydrates. The food is then swallowed down the esophagus through peristaltic contractions. The second stage, stomach, the chemical grinding mill. Food moves to the stomach, a J-shaped organ capable of strong contractions, to mix food with hydrochloric acid and protein-digesting enzymes like pepsin. This process transforms food into a semi-liquid mixture called chyme. The third stage, small intestine, the nutrient absorption center. Chyme is then propelled into the small intestine, where the majority of digestion and nutrient absorption occurs. The small intestine is divided into three parts: the duodenum, jejunum, and ileum. To here, chyme continues to mix with bile from the liver, which helps emulsify fats, and pancreatic juice from the pancreas containing various enzymes that digest carbohydrates, proteins, and fats. Once broken down into smaller molecules, nutrients are absorbed through the walls of the small intestine into the bloodstream. 1. all1fitness.com, all1fitness.com. 2. www.docsity.com, www. The fourth stage, large intestine colon, the water recycling and stool formation plant. The remaining chyme, including water, undigested fiber, and other waste products, moves into the large intestine. Here, water is reabsorbed back into the body. The rich gut microbiota in the large intestine continues to ferment undigested fiber, producing beneficial short-chain fatty acids, SCFAs. Finally, the solid waste is concentrated and forms stool, which is stored in the rectum before being expelled through the anus. Part 2. Decoding the language of stool. Key factors to observe and their meanings. Stool is not just waste. It's also a detailed health report on your digestive system and overall bodily condition. Here are the important factors you need to observe and their potential meanings, shape and size. The Bristol stool chart. This is a useful tool for describing the shape and consistency of stool, divided into 7 types. O type 1, separate hard lumps, like nuts hard to pass, usually indicates severe constipation. Stool moves very slowly through the large intestine, causing excessive water absorption and the formation of hard lumps. O type 2, sausage-shaped but lumpy, also a sign of constipation, but less severe than type 1. O type 3, sausage-shaped with cracks on the surface, considered normal. Stool moves through the intestines at a reasonable pace. O type 4, sausage-shaped, smooth and soft. This is the ideal stool form, easy to pass. O type 5, soft blobs with clear-cut edges passed easily, often indicates a lack of fiber or stool moving through the intestines faster than normal. O type 6, fluffy pieces with ragged edges, a mushy stool, a sign of mild diarrhea. O type 7, watery, no solid pieces, entirely liquid, diarrhea. Stool moves too quickly through the large intestine. not allowing enough time for water absorption. Size. Stool that is consistently too small or too large compared to your norm can be a sign of underlying issues. Small, pencil-thin stools might suggest a narrowing in the colon. Very large stools could be related to a high-fiber diet or absorption problems. Color. The color of stool is usually influenced by diet and bile. However, some unusual colors can be warning signs. Brown. The normal color of stool is due to the presence of stercobilin, a byproduct of bilirubin, a component of bile breakdown. Green can be due to eating a lot of green vegetables containing chlorophyll or stool moving too quickly through the intestines, not allowing enough time for bilirubin to be fully metabolized. Yellow may indicate the presence of excess fat in the stool. Steatorrhea, often seen in fat malabsorption issues, for example, celiac disease, Crohn's disease, pancreatic problems. It can also be due to rapid stool transit. Black, tarry stools melena are often a sign of bleeding in the upper gastrointestinal tract, for example, stomach or duodenal ulcers. Digested blood turns black. This needs to be distinguished from black stool caused by iron supplements or black foods like black licorice. Red, bright red blood in the stool, hematochezia, usually indicates bleeding in the lower gastrointestinal tract, for example, hemorrhoids, anal fissures, ulcerative colitis, polyps, or colorectal cancer. White or clay-colored can indicate a blockage of the bile ducts, preventing bilirubin from entering the intestines, resulting in pale stool. Texture. The texture of stool reflects its water content and the time it spends in the large intestine. Hard, lumpy, often a sign of constipation, dehydration, and lack of fiber. Soft, smooth, the ideal texture, indicating good balance. Loose, watery, diarrhea, which can be caused by infections, food poisoning, food intolerances, or other medical conditions. Mucus. A small amount of mucus in stool is normal, helping to. However, increased mucus can be a sign of inflammation in the intestinal tract, for example, ulcerative colitis, Crohn's disease. Frequency. Normal bowel movement frequency varies from person to person, ranging from 3 times a day to 3 times a week. A significant change in frequency to frequent or to infrequent can be a sign of a problem. Smell. Stool usually has a characteristic odor due to bacterial activity in the gut. However, an unusually foul or sour smell can suggest issues like infection, malabsorption, or an overgrowth of certain bacteria. Presence of abnormal components. Blood. As mentioned above, blood in the stool, always a concerning sign and requires medical attention. Mucus. Large amounts of mucus can indicate inflammation. Undigested food. A small amount of undigested food, especially the skins of fruits and vegetables, can be normal if you eat quickly or don't chew thoroughly. However, a large amount of undigested food may suggest absorption problems or rapid stool transit. Parasites. The appearance of worms or other parasites in the stool is a clear sign of a parasitic infection. Part 3. The detailed health report. How stool relates to specific medical conditions. Observing stool can provide important clues about various health conditions. Digestive disorders. Constipation. Hard, lumpy stools, types 1 and 2 on the Bristol chart. Fewer than 3 bowel movements per week. Feeling strained during bowel movements can be caused by lack of fiber, dehydration, inactivity, medication side effects, or other medical conditions. Diarrhea. Loose, watery stools, type 6 and 7 on the Bristol chart. Frequent bowel movements can be caused by infections, bacteria, viruses, parasites, food poisoning, food intolerances, for example, lactose, irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), or medication side effects. Irritable bowel syndrome (IBS), a common functional digestive disorder causing symptoms like abdominal pain, bloating, and changes in bowel habits. Constipation, diarrhea, or alternating stool can have various shapes and consistencies. inflammatory bowel disease, IBD, Crohn's disease, and ulcerative colitis, chronic inflammatory conditions of the digestive tract. Stool may contain blood, mucus, and changes in frequency and consistency. Malabsorption, conditions that prevent the body from properly absorbing nutrients, for example, celiac disease, pancreatic insufficiency. Stool is often pale, fatty, shiny, floating, and foul-smelling. Liver and bile duct issues, bile duct obstruction. Stool can be white or clay-colored due to a lack of bilirubin in the intestines. Urine may be dark. Infections. Stool may be loose, have an unusual foul odor, and may contain blood or mucus. Other symptoms like fever, abdominal pain, nausea, and vomiting may be present. Colorectal cancer. Persistent changes in bowel habits, new onset constipation or diarrhea. Blood in the stool bright red or black, narrow, ribbon-like stools, persistent abdominal discomfort, and unexplained weight loss can be warning signs. Other conditions: gastrointestinal bleeding, black, tarry stools, upper G bleed, or bright red blood in the stool, lower G bleed. Anal fissures or hemorrhoids often cause bright red blood on the surface of the stool or toilet paper. Part 4. The user manual for your digestive system. Tips for maintaining ideal stool and optimal gut health. To ensure your digestive system functions smoothly and your daily report is always in the best condition, follow these tips. Eat a fiber-rich diet. Increase your consumption of green vegetables, fruits, whole grains, legumes, and nuts. Fiber adds bulk to stool, softens it, and promotes regular bowel movements. Stay hydrated. Water helps maintain stool moisture and prevents constipation. Aim for 2 to 2.5 liters of water per day. Exercise regularly. Physical activity helps stimulate bowel movements and improves digestive function. Eat slowly and chew thoroughly. This helps break down food into smaller particles, making it easier to digest and reducing stress on the digestive system. Establish a regular bowel habit. Try to have a bowel movement at the same time each day, preferably after breakfast. Listen to your body. Go when you feel the urge. Don't try to hold it in. Limit processed foods, fast food, and sugary drinks. These are often low in fiber, high in unhealthy fats, and contain additives that can harm the digestive system. Be mindful of medications. Some medications can cause constipation or diarrhea. Consult your doctor if you experience digestive issues after starting a new medication. Manage stress. Stress can negatively impact the digestive system. Find effective relaxation techniques. Consider probiotics and prebiotics, following expert advice. Supplementing with probiotics, beneficial bacteria, and prebiotics, food for beneficial bacteria, can help improve gut microbiota health and digestive function. Observe your stool regularly. Pay attention to any changes in shape, color, texture, or frequency. Don't hesitate to talk to your doctor. If you notice any concerning changes in your stool, especially the presence of blood, see a doctor immediately for diagnosis and timely treatment. Conclusion: your stool is not just waste. It's a valuable source of information about your health. Observing and understanding the language of your stool can help you detect potential health issues early and take timely intervention measures. Make stool observation a part of your daily healthcare routine. Listen to your body. Pay attention to the smallest signals, and don't hesitate to seek help from healthcare professionals when needed. Your health is in your hands, starting with the seemingly smallest things. If you found this information helpful, don't forget to like this video and share it with your friends. And to not miss out on other valuable health knowledge from Health Decode, hit the subscribe button right now. Thank you for watching.